Welcome to our monthly show looking at ways to improve health, reduce disparities and combat global threats. This is Global Health TV. In today's show, we speak to former US Surgeon General David Satcher, who's dedicated his life to his quest for equity for all.
We live in a global community, and we have to approach it that way. We have to, because we gain too. When we work with people all over the world, we find new answers, new opportunities to move forward.
But first, with climate change increasing the risk of natural disasters, I'm absolutely delighted to be joined by Dina Blair, who's at the American Public Health Association conference in Denver, Colorado. And Dina is joined by psychiatrist Annelle Primm.
Thank you, Stephen. With COVID-19, I know we have seen mental health issues increase, substance use issues. When we talk about natural disasters, anxiety, depression, PTSD all go up. How do we mitigate that?
I think it's really important after a disaster to maximize mental health by employing 5 main elements: promoting calm, promoting safety, promoting self-efficacy and collective efficacy, meaning that you can encourage people that they can do things, they can establish some of their normal routine even in the midst of a disaster. And then connection is a part, and then finally hope, letting people know that things can and will get better. Of course, if people have pre-existing mental illness, they are more likely to have an exacerbation after disaster. And for those individuals, we need to make sure that they know where to get their medication or to find ways of getting some sort of mental health support. If psychiatrists and other mental health professionals aren't available, sometimes we have to resort to connecting with the primary care sector and then having mental health consultation. Fortunately, because of technology, we now have telehealth, telemental health. And so, at remote distances, we're still able to provide some sort of support and care.
But clearly these disasters are not just happening in our country, they're happening globally as well. So how do we really stay connected in that way?
Technology is very helpful in staying connected, and with social media, there's so much information being shared all the time. I know there's a lot of bad information being shared, but there's also a lot of good information being shared. But I think one of the critical issues is making sure people have access to that technology, and unfortunately, there are disparities and inequities both in our country and across the world in that regard. So there are some people left out of that. But I think public health professionals who are working in various settings in low and middle income countries are able to bring that information about mental health, which is, mental illness, and depression in particular is a leading cause of disability around the world. And so I think there is much greater consciousness of this, and people employing strategies to even utilize everyday people as a part of kind of the peer support. It doesn't always have to hinge on professionals, but lay people and community health workers can be involved in supporting mental health worldwide.
And that gets back to your key focus, and that is connectedness. Is there anything that is perhaps the most important to start and begin to get that sense of connectedness back after a natural disaster?
I think one part of it is making sure our communities are not forgotten. The communities that I've been focused on, historically racially marginalized communities, have often been bypassed, and so the group of mental health professionals, first responders, faith leaders, and community activists and health advocates have come together after disasters to make sure that we are reaching out to some of the communities that may be bypassed. And I think raising that awareness and also ensuring that disaster professionals are diversified. At this point, they really are not. They're very much in the minority, and we know that those disparities are connected to the dearth of disaster professionals. And so there are currently opportunities with organizations like the Historically Black College and Universities Emergency Management Consortium, which is raising awareness about careers in the disaster professions, and in the hopes that we will diversify among the cadre of disaster professionals. And that's going to mean that those communities will no longer be left out, and they'll get the same kind of attention that other communities get. It's really critical to reach that equity.
But now let's talk to former Surgeon General David Satcher, who was inspired to become a physician by an African-American doctor who saved his life from whooping cough when he was a young child. Dina Blair caught up with Dr. Satcher.
We are now delighted to be joined by former U.S. Assistant Secretary for Health and the 16th Surgeon General of the United States, Dr. David Satcher. Thank you for being here. I'm honored to meet you, certainly. You have been dogged in your pursuit for health equity. So I want you to tell me, in your perspective, how far we've come, and perhaps more importantly, how far we still need to go.
I have tried to be dogged, and because as you probably well know, I almost died of whooping cough when I was about 1.5 years old. And that story, was told to me over and over again by my mother and others. There was one black physician in Anniston at that time, Dr. Jackson. So I grew up determined that I was going to try to make a difference in that area.
And your book, which is, My Quest for Health Equity.
Yes.
When people read that, what do you hope they take away?
I've come a long ways in this quest. I mean, I've helped a lot of other people along the way. I've motivated a lot of young people to go into medicine and nursing and public health and areas like that. That's the most important thing we can do in the quest, is to keep building a core of people. At the Satcher Health Leadership Institute, we like to say, if you're serious about eliminating disparities, first you have to care enough. You really have to care about people and want to make a difference in their lives. Secondly, you need to know enough. You need to really know the facts and to know where the opportunities for intervention are. Thirdly, you have to have the courage to act. As a student at Morehouse, I virtually took a chance of giving up my career in order to go to jail. There was only one restaurant, I believe, in Atlanta at the time that would serve blacks. So we, the students, decided that we were going to intervene, even though it meant going to jail and, in one case, prison. So, I think the third thing is you have to have the courage to act. And finally, you have to be willing to persevere. And you can imagine, at my age, I've done a lot of persevering. But I've been fortunate, and hope that other people will not, have to fight the same battles again. Even though obviously we're not there yet, we've come a long ways.
Sadly, in this time, all these years later, health inequities are on the rise globally. What is it that the U.S. can do to try to reduce those disparities?
I really appreciate the opportunity I've had to work globally. And that's one of the reasons I value the time I spent at the CDC. And that was the time that I probably did most global work, like immunizing almost 100 million children in India against polio. And I could go on and on, the work we did in Kenya. We live in a global community, and we have to approach it that way. We have to, because we gain too. When we work with people all over the world, we find new answers, new opportunities to move forward.
That's it, I'm afraid, for today's program, but be sure to catch up with our recent videos on human rights and population-based science with Johns Hopkins and the Imperial College's REACT study. So until next month, Global Health TV, it's goodbye.